Hi, everyone. I'm Danny Parra with the American Red Cross. As a member of the communications team here at the Red Cross, I get all kinds of questions all the time about blood donation. So I'm very lucky to be able to sit down with some of our medical experts to find those answers to those questions. Joining me today is Dr. Courtney Lawrence, Division Chief Medical Officer here at the American Red Cross. And Dr. Lawrence, thanks so much for joining us.
Thank you for having me, Danny.
All right, Dr. Lawrence, I want to delve a little deeper into what is one of the most common chronic blood conditions in the United States, and that is sickle cell disease. Can you tell us a little bit more about that?
Yes, absolutely. Sickle cell disease is a topic that's near and dear to my heart. So sickle cell disease is a blood condition that's inherited or genetic, and it affects the red blood cells. So hemoglobin is the protein that carries oxygen within our red blood cells. And someone who has sickle cell disease creates a different type of hemoglobin, and we call it sickle hemoglobin. And what that means are those red blood cells in someone with sickle cell disease aren't able to tolerate certain types of stress. We typically rely on our healthy red blood cells to be very flexible, to be able to move through the tiniest blood vessels in our body to deliver oxygen to all of those tissues. But in someone with sickle cell disease, when they're sick, when they're stressed out, those red cells can actually become misshapen. They can become rigid and inflexible. And that means that they can stick to one another, they can stick to the blood vessels, and they can actually block blood flow and oxygen getting to those tissues. It also means that those red blood cells are more vulnerable. So for the average person who does not have sickle cell disease, our red blood cells usually stay around in our bloodstreams for about 3 to 4 months on average. But in sickle cell disease, because those red blood cells get so injured, oftentimes they only live 2, maybe 3 weeks in the bloodstream before they're either broken apart or cleared out of the bloodstream. And so that can also mean that people with sickle cell disease have much lower hemoglobin levels than someone without sickle cell disease.
And how common is sickle cell disease?
Yeah, so sickle cell disease affects about 100,000 Black or African Americans here in the United States, but affects more than 7 million people worldwide. So it is a prevalent blood condition that we need to be concerned about.
And for the more than 100,000 Americans who have sickle cell disease, what is life like for them? What are the symptoms? What do they have to go through as they live with and manage this illness?
Well, it's important to know that about 90% of adults living with sickle cell disease will require at least one blood transfusion throughout their lives. And 1 in 10 children with sickle cell disease, if not properly screened and treated with therapies like blood transfusions, can develop stroke, which if any of you know somebody, usually an adult who's had a stroke, it can cause lifelong challenges and impairment. So there are very many serious medical conditions that can come from sickle cell disease.
So, Dr. Lawrence, since sickle cell is a genetic disease, is there a way for expectant parents to find out if their child will be more likely to have sickle cell?
Yes, there absolutely is. So the most important part is that both parents need to know whether they have sickle cell trait or a hemoglobin that, when paired with sickle cell trait, can cause a form of sickle cell disease. And the best way is for each parent to have sickle cell trait testing. One way this can be done is if they come to donate at American Red Cross and they self-identify as being Black, African American, or multiracial, they will automatically have sickle cell trait testing done, and they will have that information provided back to them. But if they're not an eligible blood donor, they can also reach out to their healthcare provider and let them know that this is a concern, and their healthcare provider can provide sickle cell trait testing for them. And once those results are back in, they can help counsel the family about what their risk of having a child with sickle cell disease looks like.
What can life be like for someone with sickle cell disease? Can they live a normal life? Can they play sports? Can they try to enjoy life the way that anyone without sickle cell can?
With proper medical care and with access to blood transfusions, it's life-changing for many of these patients. We know in some areas where patients with sickle cell disease don't have access to blood transfusions, many of children with sickle cell disease won't reach adulthood. But here in the United States, with access to comprehensive sickle cell care centers and access to blood transfusions, most patients with sickle cell disease are able to live full lives and go about and do the things that those without sickle cell disease do. Give back to their communities, go to school, go to work, enjoy the hobbies and sports that they love.
Well, thanks so much, Dr. Lawrence, for teaching us more about sickle cell disease. And if you have any more questions about this condition or how you could help people who are living with sickle cell disease, just head over to redcrossblood.org. Dr. Lawrence, thanks so much.
Thank you, Danny.